Yeah,
stuff
lots of
there.
other questions. One of the other considerations in terms of how folks can think differently about this, there was a question around, or someone had sort of commented how they leverage different workforce to support these early sessions, whether it's data capture or whether it's who you speak to in those first sessions. One of the comments was around leveraging their peer support specialists. Any comments you'd have around that workforce angle of how you think about which of your workforce is doing which component and how that might streamline some of this?
Yeah, let me take this one first, Scott. When I ran the mental health center, we were acutely aware of this problem. This was um, between 1995 and 2008 or something like that. That we were very aware of this problem even then, and we didn't see peers were not part of this process as much as they are now. There were some, but not very much. But our outpatient director said, we knew that our second appointment no-show rate was running about 50%. 50% for the first session and then 50% again for the second session. So we knew whatever was happening in that first session was not meeting people's idea of what they wanted, or they would have all come back. So she changed the outpatient director changed that. And that first session we treated as just really, and it was based on the assumption that people were shopping. They were trying to figure out if what we had to offer them was what they wanted to buy with their time, money, or energy. And she put interns in that first slot. They were 30-minute slots. We didn't open up a chart on them. We just opened up a potential chart. A lot of your EHRs can give you like somebody called in about services. We start at the beginning of a chart, but we're not opening up a formal chart. And that's what we did. And then they took the time to talk about why they were there, what we could offer them, how long would it take. And then they said, is this something you want to do? And we made it very easy for them to say no. And if they said no, give them a card and say, call us when you're ready. But then the people who said yes, our no-show rate for the second appointment went to zero.